These are challenging times, as we know, especially for stroke survivors and those with heart disease, really regardless of their age. If you or someone you love is a heart patient or stroke survivor of any age, they may face increased risk of complications if they contract COVID-19. The situation is rapidly evolving, as we know. Scientists are learning more every day. The American Heart Association is funding new research and connecting researchers and doctors with the latest information. Joining me now is Dr. Ricardo Hanel, who is the director of the Baptist Neurological Institute and is also an American Heart Association board member. Doctor, good morning. Always great to see you on the morning show.
Good morning.
Can you explain the risks that stroke survivors in particular face if they were to contract COVID-19?
Yeah, it's not uncommon to have on patients that are stroke survivor and heart attack survivors many risk factors like diabetes, obesity. So that bring that population to higher risk of suffering worsening outcomes if they have COVID and COVID-19.
I think that there are a lot of people, as we're all trying to understand what this does to the body, and we hear, unfortunately, we tend to kind of go to the worst when we realize that most people who contract COVID-19 really have mild symptoms. That said, people who are listening here this morning and who are worried, I mean, what kind of heart disease are we talking about that makes someone at a higher risk? For example, if someone takes blood pressure medicine, does that somehow put them at a higher risk?
There was some relation of some high blood pressure medications, but as you said, Jen, this is all very new and it's hard to make a specific claim of one medication versus another. You got to talk to your doctor and get well informed, and every case is different, every person is different. You got to get well informed. But people, for example, with congestive heart failure, where the heart as a pump is not working as well, those people would fare worse if they happen to get COVID-19 because of the baseline condition.
So then if someone is infected, as an example, does it put that person then at a greater risk of having a stroke?
That's a great question. We don't have, thankfully in Northeast Florida, we have a low prevalence of the COVID-19, but colleagues from Wuhan in China, New York City, like Jay Moko and Pascal Jabbour in Philadelphia. Those are colleagues in hot spots in the country, in the world. They have seen an increase in number of strokes, especially stroke in young people, what is very concerning because of the COVID-19. So yes, COVID-19 is making people more prone for strokes.
And I think that is a really important point. In fact, we spoke with a cardiologist about a week and a half ago about something similar to that. And I think that what's important for our viewers to understand is that while younger people are not considered to get as sick, assuming they don't have underlying medical conditions, as a result, if they were to catch COVID-19, they may not realize, because they think, hey, I'm young, they may miss the signs of stroke or some kind of a heart condition because they don't even know they have COVID-19.
Yeah, I think you gotta stay aware, and all hospitals are prepared to receive these patients and separate COVID from other problems or put them together if that is the case. But I think the fear of COVID should not impede you from seeking medical care. Not because COVID is here that the other problems will stop happening. And we see this a delayed in seeking medical care. People just stay home because they're afraid of COVID-19 and end up not getting the opportunity to be treated for other possible treatable problems.
And we have seen, in fact, we've talked to a number of different hospitals, and they've all said that they have seen a decrease in the number of people who are calling because they are nervous about going to the hospital. That said, for those who are nervous and maybe hesitant, who are stroke survivors, as an example, and maybe become symptomatic and worry that it is COVID-19, what should they do?
Again, if this is emergency symptoms, you never had a stroke symptoms before, you always dial 911, and all EMT in the region, our paramedics are extremely well trained and prepared to help everybody. They'll go get you, and 911 is the right thing. You can always reach out to your doctors. Our doors, our phones are open. We're always here available to talk to you and answer your questions. Our nurses and team, they're all in place to help you if you need us.
Yeah, it's amazing what we've all had to learn how to do, albeit telemedicine is an example, which I'm sure you're doing a lot of. But the reality is that the doctors are still here for you and available. You might not be able to see them in person, but when you need them, they're there. Dr. Ricardo Hanel joining us from Baptist. Thank you so much, Ricardo. Appreciate it. Have a good day.
Thank you, guys. Stay well.